Heart disease and stroke, two of the world's leading causes of death. Every year, millions of people around the globe are affected by these life-threatening conditions. In fact, according to the World Health Organization, cardiovascular diseases claim an estimated 17.9 million lives each year, representing 32% of all global deaths. That's nearly 1 in every 3 deaths worldwide. But what makes these conditions so dangerous, and what can we do to protect ourselves and our loved ones? But what exactly are heart disease and stroke, and can we prevent them? Let's break down the facts, the warning signs, and the steps you can take to stay healthy. The cardiovascular system is our body's lifeline, pumping blood, oxygen, and nutrients to every cell. This intricate network of the heart, blood vessels, and blood keeps us alive and thriving. When it's working well, we rarely notice it. But when something goes wrong, the consequences can be sudden and severe. But when this system breaks down, serious health issues can follow. Blockages, clots, or weakened vessels can disrupt the flow of life-sustaining blood, leading to emergencies like heart attacks and strokes. These events can happen to anyone, at any age, but certain factors can increase your risk. Heart disease is a broad term for conditions affecting the heart. It includes coronary artery disease, heart failure, arrhythmias, and more. Each type affects the heart in different ways, but all can have serious, even fatal consequences if not managed properly. The most common is coronary artery disease, when arteries become clogged and blood flow to the heart is reduced. Over time, fatty deposits called plaque build up inside the arteries, narrowing them and making it harder for blood to reach the heart muscle. This process, known as atherosclerosis, can start early in life and progress silently for years. Symptoms include chest pain, shortness of breath, and fatigue. Some people may also experience pain in the neck, jaw, or back, nausea, or lightheadedness. It's important to remember that symptoms can be different for men and women. Women, for example, may have less obvious signs, such as unusual tiredness or indigestion. Left untreated, it can lead to heart attacks and heart failure. A heart attack happens when blood flow to part of the heart is completely blocked, causing damage to the heart muscle. Every minute counts. The longer the heart goes without oxygen, the greater the damage. That's why recognizing the warning signs and acting fast can save lives. A stroke happens when blood flow to the brain is interrupted, either by a clot blocking a blood vessel, called an ischemic stroke, or by bleeding inside the brain, known as a hemorrhagic stroke. Both types can cause brain cells to die within minutes, leading to permanent disability or even death. This can damage brain cells in minutes, leading to disability or death. Remember the signs: FAST, face drooping, arm weakness, speech trouble. Time to call emergency services. If you notice any of these symptoms in yourself or someone else, don't wait. Call for help immediately. Quick action can make the difference between a full recovery and lasting damage. Time to call emergency services. Every second counts. The sooner treatment begins, the better the chances of survival and recovery. Emergency teams are trained to respond quickly and provide life-saving care on the way to the hospital. Risk factors for heart disease and stroke are often the same: high blood pressure, smoking, diabetes, obesity, and inactivity. Other factors include high cholesterol, excessive alcohol use, chronic stress, and a family history of cardiovascular disease. Some risks, like age and genetics, can't be changed, but many are within our control. Doctors use tests like ECGs, echocardiograms, and scans to diagnose heart disease and stroke early. Regular checkups can catch problems before they become emergencies. If you have risk factors, your doctor may recommend additional tests or monitoring to keep your heart and brain healthy. Treatment may involve medications, surgery, or lifestyle changes. Medications can help control blood pressure, lower cholesterol, prevent clots, and manage diabetes. In some cases, procedures like angioplasty, stent placement, or bypass surgery are needed to restore blood flow. But the foundation of good health is always a healthy lifestyle. Stroke recovery often includes physical and speech therapy. Rehabilitation helps patients regain strength, mobility, and communication skills. Recovery can be a long journey, but with support from healthcare professionals, family, and friends, many people make remarkable progress. Support groups and the counseling can also help survivors and their loved ones cope with the emotional impact of stroke. The best way to fight heart disease and stroke? Prevention. Small changes can make a big difference. Regular physical activity, a balanced diet, not smoking, and managing stress all help protect your heart and brain. Even simple steps like taking the stairs, eating more fruits and vegetables, and getting enough sleep add up over time. A healthy lifestyle, Regular checkups and managing conditions like diabetes can save lives. If you have high blood pressure or high cholesterol, follow your doctor's advice and take your medications as prescribed. Monitor your blood sugar if you have diabetes, and keep your weight in a healthy range. Every positive choice you make helps lower your risk. Heart disease and stroke can be deadly, but with awareness, early action, and healthy habits, we can protect ourselves and our loved ones. Education is key. Share what you've learned with family and friends. Encourage those around you to get regular checkups and make heart-healthy choices. Together, we can build a healthier future for everyone. Take care of your heart and brain for life. Remember, prevention starts today. Make the commitment to your health and inspire others to do the same. Your actions can save lives, maybe even your own. Let's hear from real people whose lives have been changed by heart disease and stroke. Their stories remind us that these conditions can affect anyone, but also that hope and recovery are possible. Meet David. At 52, he thought he was healthy, until one morning he felt crushing chest pain and was rushed to the hospital. Doctors found a blocked artery and performed emergency surgery. "I never thought it would happen to me," David says. "Now I walk every day, eat better, and never miss a checkup. I'm grateful for a second chance." Sarah was only 34 when she suffered a stroke. "I couldn't move my right side or speak clearly," she recalls. "It was terrifying. But with therapy and support, I learned to walk and talk again. I want others to know the signs and never give up hope." Maria and Louis, both in their 70s, manage high blood pressure and diabetes together. "We cook healthy meals, take our medicine, and go for walks," Maria shares. "We want to be here for our grandchildren. Taking care of our hearts is taking care of our family." Did you know that up to 80% of heart disease and stroke cases are preventable? By making healthy choices and managing risk factors, you can dramatically lower your chances of a life-threatening event. Here are some tips to protect your heart and brain. Quit smoking. Even one cigarette a day increases your risk. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins. Get at least 150 minutes of moderate exercise each week. Manage stress with relaxation techniques, hobbies, or talking to someone you trust. Keep up with regular medical checkups and screenings. Don't fall for common myths. Heart disease and stroke are not just old people's problems. They can strike at any age, and sometimes without warning. Even if you feel healthy, regular checkups and healthy habits are essential. Make prevention a priority. Schedule your next checkup today and encourage your loved ones to do the same. Celebrate every healthy choice. Each one brings you closer to a longer, happier life. Remember, you're not alone. Join a community, find a workout buddy, or share healthy recipes with friends. Support makes it easier to stick with good habits and overcome challenges. Heart disease and stroke are serious, but with knowledge, action, and support, we can all live healthier, longer lives. Take the first step today. Your heart and brain will thank you. Know the signs. Act fast. Live well. For more information, talk to your doctor or visit trusted health websites. Take care of your heart and brain for life.